Hospital. Let's get the very latest. Maageketla, a very good afternoon to you. What are you witnessing there?
Yeah, a very good afternoon, Blaine. As you can see, these are live visuals from Baragwanath Hospital, where Acting Health Minister Mmamoloko Kubayi-Ngubane has just arrived, flanked by Gauteng Premier David Makhura. Of course, she's actually been taken through the processes that are actually happening here. And as far as the admission of COVID-19 cases are concerned, and also perhaps taken through the processes, and as far as this section where we are, it's a vaccination site. As you can see, some of the chairs that are here, she's been told by one of the officials at the hospital just the processes really of how. And I'm just going to actually throw in the mic there so that you may get a sense of what's happening.
The over 80s, the more elderly, so we'll always bring them to the front of the queue.
Okay.
And indeed, they'll be coming straight in. We won't have to have them. So we just have to try to watch for the ones who are immobile and have challenges with that.
Okay.
So watch the step. Let's go through. We're trying to put up some. We put up some signs just showing some of the information, and just so that people feel more comfortable. I'm also going to spend.
So you might need them even in different languages.
Yes. That's a point.
Yeah. So that somebody can read in Sizulu and all these things. But also especially for the elderly.
And we are actually entering one of the vaccination sites here, alongside the acting minister herself. And as you can see, there are elderly people sitting and, of course, are waiting their turn to actually to get vaccinated. And they are actually addressing them, as you can see.
You will, of course, understand that our good minister here is here to assist us in the support of the vaccination rollout. So we would like to I would like to give you some information. Colleagues, can I just ask you, I do need to speak to colleagues here who are about to get their vaccination.
And also there's social distancing amongst the senior citizens as well.
Please.
Colleagues from the media.
Colleagues from, if you could just step aside just to the back so I can speak to colleagues. So thank you for your patience with us. And can I just say a warm welcome to Chris Hani Baragwanath Hospital today for your vaccination. Please be aware that you will be receiving the vaccination today, and you will be then receiving an SMS on your phone that is a record of your SMS of your vaccination today. It is, of course, the Pfizer vaccine that is today that you will be receiving, the first of 2 doses. And you will receive that today, and then we will give you another SMS in 42 days' time. So you can return, of course. Okay? And so if you have any questions, then we will, of course, explain to you. Please be aware that if you have had any injection before and have had a serious reaction to the injection, medicine or vaccine, then you must please tell me. But otherwise, the allergies to food and to medicines and the like, we can talk about those, but they're generally not a problem with this vaccine. Okay, remember that this is the Pfizer vaccine, and that business, some of you may have heard the information about the clotting for the Johnson & Johnson, which is a very rare side effect. There is not that side effect with the Pfizer vaccine. Okay? We will keep you for 10 minutes afterwards, and you will please, we want to observe you for 10 minutes afterwards, and we will tell you about the mild small inyana side effects that you may or may not experience. Okay? Thank you very much. We'll be going through in 1 minute. Thank you.
That's Richard Koch, Professor Richard Koch from Baragwanath Hospital, and of course assuring the elderly here who are sitting and waiting to get vaccinated, and telling them that they should just rest assured that there won't be severe side effects once they get to be vaccinated. And as you can see, Gauteng Premier as well getting in to actually make sure that she understands the processes, considering that she is just an acting health minister, and obviously she will then have to be sensitized and of course taken through the whole process of being vaccinated here at Baragwanath Hospital. And I can tell you, Blaine, that we actually waited about 4 hours for this event to take place, and that's simply because she was being briefed in a closed meeting, and you can just imagine the mammoth task that the health department is actually facing amid this pandemic. Yes, cases continue to actually go up in Gauteng. We know that nationally in the last 24-hour cycle we had about 8,000 new cases. Gauteng, of course, leading and shooting more than half in as far as that number is concerned. But again, I'm just going to pause a bit and throw in the mic so that you may get to understand what she is being introduced to here.
And asking the appropriate questions. Okay.
So then they get their jab here, and then where do they go for the 10 minutes waiting?
Okay, so just outside they just go outside and they sit comfortably in the sun there, outside, and just on the other side, on that side, you'll see in that corner is our resuscitation area there, and of course we have very few instances of reactions. If anything, it's more about anxiety or some concern, you know how. And then, of course, we need to be respectful of that and take good care of our clients. So the resuscitation area on the other side there. Okay.
So you don't know, is there any patient who is ready to vaccinate?
Yes.
Immediately?
Yes, that's we can.
I think we want live.
Please, we will certainly do so. Thank you for that. So we'll just step aside for a minute.
All right, Gauteng Premier David Makura asking for at least one patient to come through, and so that acting minister may actually be able to see the whole process in as far as vaccination is concerned, and of course social distance being emphasized here, because of course to try and avoid crowding, considering that there are people, especially the elderly, who are over 60 of age or even 60 plus of age, who are actually going to be coming through. And as you can see, one of the elderly citizens taken through the process here, and just to make sure that she gets to be vaccinated, and this is perhaps important to note, Blaine, because I was speaking earlier on with the communication office at Baragwanath Hospital, where we understood that this hospital has about 2,666 beds. And since that Charlotte Maageketla fire, some of the patients have been transferred here. But we also understand that the hospital is 99% full with patients, both COVID and not COVID-19 related. And in as far as COVID is concerned, 273 beds are here at the main hospital, and there are 2 wards turned into COVID wards at this particular hospital. And we also understand that immediately after that Charlotte Maageketla hospital fire, there were about 3 wards opened about 3 weeks ago with additional 75 beds. I'm just going to throw this mic in there again, Blaine, so that we can get to hear the conversation between the acting health minister as well as one of the elderly.
Ukubalulekile kakhulu ukuthi mawusuka lana ke uzimamele ukuthi uba nokunye ukuthi kukwenza ukuthi ungekho right, yayibona, bese makwazi ukuthi bangithi bazokugcina for 10 minutes bakutshelile kuphi likhona la mawuceda ukujova bayakugcina nje for 10 minutes la ngaphandle ukuthi bakwazi ukubheka ukuthi ngabe ukhona ongekho kahle uba right, but noma sobuyele ekhaya ne uzibheke nawe uzizwe ukuthi khona okungajwayelekile emzimbeni kwakho. Yeah, kufanele uhlale ekhaya uzwe mangabe khona okuzwayo okungajwayelekile emzimbeni wakho ubuye ureport yangithi yabacela nje abantwana bathumele iWhatsApp lapha or SMS ukuthi nokhona and then bazokwazi ukukusiza.
Alright.
And then after futhi iloko wokucala uzobuya futhi uzothola omunye umjovo bese uyaqeda kulo mjovo lo uFizer ukayi2 uthola yokuqala namhlanje uzothola enye after 42 days. Yeah. Okay, sakujabulisa kakhulu sijabulile ukuthi nawe ufikile. So uregister kanjani ma?
Hayi ngi right yonke into.
Uright yonke. Uncedisa ubani ukuthi ubhalise uzelana?
Abantwana
bakho bakubhalisele bakwenzele yonke into. Hayi siyabonga kakhulu asibabonge nabantwana. Ngiyabonga ma. Okay sister.
And of course, language is very important here, Blaine. And of course, one of the elderly citizens explained the process here. And as far as this vaccination is concerned, and of course, the acting health minister, Mmamoloko Kubayi-Ngubane, telling her that once she's vaccinated, then she's going to actually sit for about 10 minutes outside as part of the observation period. Yet she's going to then again come back here after 42 days to get the second jab, which is of course to make sure that many of our elderly citizens are protected, and they are then going to actually jab her. And you can see she's been asked if she's allergic to any medication, or if there's any medication that she's currently taking as an elderly person. So this is just part of the process when some of these elderly citizens are being vaccinated. And I can tell you that one of the questions that I overheard Acting Health Minister ask her was, who assisted you to actually register to be here? She said her children did that. But I can tell you that Gauteng Province, in as far as health department is concerned, they did mention that they are not going to be turning anyone away from the vaccination sites, whether you've registered on the EVDS system or not. They will assist them to register on site and to make sure that the elderly citizens are vaccinated. And there have also been concerns about the turnout as far as registering online is concerned, and Gauteng department as well, health department, expressing concern there, saying that it looks like people are not registering in numbers, and perhaps even nationally. Let's talk about the waiting for that JJ doses. We know that we heard in fact that about 300,000 J&J doses are actually cleared to come to South Africa. They're probably on their way now, and I think this should be some form of relief for the National Health Department, considering that it looks like this vaccination rollout has been at snow's pace. So that's one of the concerns that we actually saw in the past few weeks. But again, I can actually mention that here at Baragwanath Hospital, when it comes to the vaccination, okay, I'm just going to pause again. I'll come to that point in a few minutes, Blaine. I'm just going to throw in the mic as they are actually trying to vaccinate her. In fact, there's no need to actually throw in the mic. I'm just going to give you some of the backgrounds that I actually gathered coming to Bara. We understand that there is, of course, as I mentioned, about 3 wards that have been opened 3 weeks ago with additional 75 beds for COVID. From what we understand is that the hospital is under to open the fourth ward, considering that the number of infections here in Gauteng continue to rise. But we also learned that it would be risky to open a fourth ward without full staff complement. Now the jab has just been administered into the shoulder of this elderly citizen here, and you saw a little bit of clap of hands, and she has now been vaccinated. Premier David Makura telling her that she will come back probably after 42 days for a second jab. So that's a process that's taking place here at Baragwanath Hospital, Blaine.
Maageketla, you spoke about the numbers in Gauteng. Nationally, as of yesterday, 8,021 new cases of COVID-19. In Gauteng, over 4,800 cases reported. You no doubt, Brother Mohlabe, have your finger on the pulse here in the province. What is the level of concern among citizens? Are we in any way changing our behavior due to the increase of numbers, or does the status quo remain?
Looks like the status quo remains plain, because that's what Gauteng Premier David Makura highlighted in that Gauteng Command Council briefing last week, Friday, when he says that there seems to be no compliance among citizens in the Gauteng Province, which is why we continue to see these numbers doubling up, or more than doubling up the national numbers that you see. 4.8 thousand new cases in the last 24 hours. That is more than double the national figure that you just mentioned. And from what we hear as well, it looks like stricter rules need to be actually put in here to make sure that people comply. He actually mentioned overcrowded places, specifically downtown Johannesburg. I'm sure you saw one of the stories a couple of weeks ago, just less than 24 hours after he announced the third wave that the province is currently facing. Yes, technically the whole country is facing the third wave, but immediately after he announced that, we saw crowds actually coming through downtown Johannesburg, some of them not wearing masks and ignoring the COVID-19 safety protocols. But I'm just going to sort of cut there a little bit, Blaine, and ask my colleague, Japan Matebula, to show you this. But he's currently trying to arrange his tripod because we are expecting a media briefing here. On my left-hand right, and excuse that shaking there because we are trying to actually scramble for space here. On my left-hand side, that's where some of those elderly that have just been jabbed are sitting. They are actually sitting under the sun there to sort of observe that 10-minute period to see if they are somehow reacting to this particular jab. But I can tell you, Blaine, that concerns have been here. And it has really been concerning to see the numbers continue to go up. But I'm just going to sort of stick in this mic so that we can then hear what Acting Health Minister, of course, shoes being too big to fill. So we're just going to hear what she has to say about this.
Check with the colleagues. Are you rolling ready?
Yeah.
Everyone's rolling.
SABC is live.
All right. Then can you just have silence, please, everybody? Colleagues and everybody around, please be silent. Thank you very much. Thank you very much to members of the media for joining us today. We won't take long, and without much further ado, let's invite the Honourable Acting Minister of Health to address us and reflect on what she has heard and seen, and then we'll take it from there. Thank you.
Thank you very much, Lwazi. Is it still morning? Yes?
You can just step.
Oh, you want me to come closer? Okay. It's already afternoon. Good afternoon, colleagues. Thank you very much for being with us today. We do apologize for the slight delay in interacting with you. As we are here, you'd know that one of the reasons I had to come into the province is that we are seeing numbers increasing across the country, but also in Gauteng. As per previously, you would have noted that every time the numbers go up, we would have to pay attention into the areas or the provinces where the numbers are going up, find mechanisms in terms of both clinical and non-pharmaceutical interventions in terms of those provinces to be able to provide a response that can help us contain the pandemic. But secondly, you know that we already have started with our vaccine rollout program, and today we are communicating good news. Many of our citizens have been saying to us the vaccine centers are only opened over the weekend or during the week. We do not have sites that are opened over the weekend, and we are showcasing the first site to be operational on a weekend, which is this one here for our vaccine rollout. We do believe that this is a massive step towards assisting us in increasing the numbers of the vaccination of our population, which is 60 plus, together with our healthcare workers. So we are excited. I have been meeting with the Premier together with the delegation of Gauteng, led by the Premier, have received reports. Firstly, in terms of how they are observing the pandemic performing in the province. Obviously, when you look at the past 3 days' numbers, you'd see that the numbers that are reflected on Gauteng are a worry. And there are areas in terms of specifically Johannesburg where we need to make serious intervention in terms of that. Secondly, in terms of looking at what else would they request from us as national to be able to assist them in intervening, in making sure that we do not have the numbers running ahead of us. We do not end up with difficulties where we have hospitals being overwhelmed and not being able to cope. So firstly, from our side as National Department of Health, we will be able to send an intervention team into Gauteng that will assist us with the human capital. That finalization we are doing with the Premier together with the MEC in Gauteng to be able to assist in terms of human capital to support the province in managing the pandemic. We are paying attention to the capacity of the province in terms of hospital beds, as we are looking at what is it that we need versus what we are anticipating. When we look at the figures and the projections, we don't think that we'll be much in trouble in terms of the numbers, but we always have to be ready. We've learned from first wave, we've learned from second wave in terms of managing the pandemic, and what we are doing now is to be able to continue with the mechanisms that have been put in place in terms of testing, tracing, isolating and treating. Those are important, and when we talk about testing, you'd note that most of the time when we start seeing that in communities, there are communities that are showing some outbreak, therefore there is a need for community intervention in those communities. So the ramping up of that you'll start seeing in the coming weeks. It is happening currently, but that will increase because we do believe that community transmissions are active and all that. But again, we want to urge people of Gauteng and broadly South Africans. What we are observing is that many people think that when you are in level 2, the pandemic has gone. So we are seeing people in parties, not social distancing, not wearing masks. And that is continuing to put pressure in our system, but contributes to what we are seeing in the numbers. So this issue of continuing to wearing our masks, continuing to socially distance, sanitizing and washing our hands remains very, very important. And we want to urge South Africans currently, If you do not have any reason to leave your homes to go and just uilo bloma, I come from Soweto, so there is no need for a bloma right now. Please make sure that you social distance, stay in your houses, stay at home, because the pandemic is not nice to be, playing with. You'd hear people who have contracted the pandemic. They will tell you even how it is and how they've battled with it. So we are not yet out of the woods, because sometimes people think that we are out of the woods. When the numbers go down, most of the time is because when we relaxed the levels and we ended up with level 1, it's because we wanted to allow economic activities to happen in the quest of managing and balancing between lives and livelihood. We've adopted a risk-adjusted strategy where the higher the numbers, the risk is, and we will increase the restrictions. The lower the numbers, we lessen the restrictions. So we are paying attention. With the reports that we have received from the province, we are confident that in the coming weeks we'll start seeing containment. Obviously, there's a lag. So it doesn't mean because today we are saying these are the interventions that we are doing. You are going to start seeing the numbers reducing immediately. So the interventions will come in to help us so that in the coming 2 weeks at least, we can start seeing some responses to those interventions, both in terms of what the province has recommended to say, we as National Department of Health needs to take to NCCC to support them and help them to manage the pandemic in the province. So I am happy about this visit, firstly being my first visit as the Acting Minister of Health, to interact with the province, and we continue in the battle against COVID-19 as a pandemic. And we do believe that we need everybody to help us. We want to continue to thank our health practitioners who continue to be the front line of fighting this battle, together with other frontline officials such as law enforcement agencies, because our progress and our work in terms of fighting the pandemic will only be achieved when we all work together. So we want to appreciate them, want to thank them, those who have availed themselves even to working over weekend to support us in the vaccine rollout. We want to say thank you very much, and thank you, Premier, for hosting us. Comrade Mayor, my apologies, I did not ignore it. We've got the Mayor of Johannesburg as the host for us in the city, who has been with us throughout the day listening to our presentations so that they can assist us in intervening where they can from their clinics, from their health portfolio. So thank you very much. I think that's it from my side.
Thank you very much, Minister. Premier, I want to just check if you want to add anything. Thank you.
I'm reluctantly adding. Firstly, we welcome the Acting Minister of Health to our province. This is where the pandemic in our country at the moment is essentially raging here in Gauteng. More than 50% of the daily infections are taking place here. We're experiencing dramatic increase in hospital admissions. We're also seeing an increase in those who are succumbing to COVID-19. The test positivity rate is extremely high, about 24% in the province at the moment. The message that we gave to the minister in the meeting that we had is that we at that time, like during the first wave, we went to national government. We asked the National Department of Health for increased level of support and intervention. We are at that level, Minister, where we are doing the same. So we will welcome, and the Minister is working out the details of increased level of intervention. We will welcome that increased level of support. The fire is raging here in Gauteng Province. There's no part of the province now, unlike the previous week, there's no part of the province now that we are safe. All the parts of the province are raging. Johannesburg, just over the last 24 hours, Johannesburg has recorded 1,900 infections over 24 hours. Tshwane has recorded over 1,200 infections. We were worried earlier about the south, which is Sidibeng. The main metros in our province, where there's high density of population, are themselves under fire from COVID-19. The infection is raging throughout the different parts of the province. What is our response? Our response basically has been to activate those ward-based response teams. We will not succeed without community cooperation, without community support. Our testing and tracing teams are also going to the ground, particularly the hotspots. The number of hotspots have increased dramatically. This week, Minister, has been particularly remarkable in the sense that we have passed 5,000 infections. The last time we were there was at the peak of both the first wave and the second wave, around July in 2020 and around end of January, early February this year. So the message we basically are sending out is that the pandemic is everywhere in the province. We need to do extraordinary things. The minister is going to consider a number of measures. Yes, we are asking for increased measures, the details of which will only be looked at based on evidence. They will be looked at based on evidence, but level 2, as we have it now, is not having a sufficient impact. People are going on as if we really not in the middle of a raging pandemic. So all those issues will be explored. We are ramping up. Many of you would know that at this point we usually look at existing bed capacity and extra bed capacity. We are looking at all those options now. The reports we have been getting from the private sector colleagues is that the system is under pressure, extremely under pressure at the moment in the private sector, and that pressure now is shifting to the public health system as well. We can feel that pressure based on the number of hospital admissions on a day-to-day basis, on a week basis. So that's that time also that we are looking at extraordinary things. Extraordinary things include measures we took last time. Some of the measures we took last time included going beyond the existing capacity that is there. So extraordinary measures are being looked at across the province to ensure that we will be able to respond adequately. But we welcome the support. We welcome the visit. We are the first province to start with the weekend vaccination program. We are going to upscale. These weekend operations are going to be upscaled simultaneously as we are fighting the fire. We are also ensuring that we stay on course on the vaccination program. Yes, the fire is raging, the infection rates are increasing, but we also want to ensure that our vaccination program keeps pace because those are the interventions we have. Lastly, I want to say that we need the support of the people of our province. At the moment, all we can say is that we are not seeing the difference in the number of people gathering at places where under the current third wave, in the middle of the third wave, we are not seeing any positive response that people understand. There was a period in January. It was amazing in January because once we said we have arrived at the second wave in January in the province, the response of the people of the province was amazing. Everybody immediately took extra measures to make sure that they protect themselves. But we're not seeing that at the moment, and we want to call for more of the support from communities. That COVID-19 is raging, the impact. The clinicians are also giving us feedback that there are People are sick. They are admitting people who are really sick. No one of us must say, I got it earlier on, so I'm okay. I can walk around. We are even saying, even those who have vaccinated, they should still continue to put on their masks. Don't say, I have vaccinated, I'm not going to put on my mask. Thank you very much, Minister, for the support we have received. We will continue to work with all the municipalities, including the city of Johannesburg, on many issues where we need to work together to solve the problems. And there are issues we are working with the city to solve very, very specific problems to help our COVID response. Thank you very much.
Thank you very much, Premier. We do have the MEC and the Mayor here. I'm going to just check. MEC, Mayor, you are covered. All right. And I'm so sorry, Sheg, we do have the Director General of PAC here as well. Sheg, you're covered. Yes. All right, well then, in that case, we can move on and take some questions. Let's start with the broadcasters. I'll start with the national broadcaster. Go ahead, sir.
Yeah, hi, this is Maageketla Mohlabe from SABC. Minister, thanks so much for your time. This is Maageketla. Just talk to us about the implications that the health department have had as far as the delay of the J&J vaccine actually caused. We understand that obviously there was that holdback in the U.S. While this national rollout was underway. Just talk to us about that.
Okay. With the J&J, we issued the statement yesterday after the FDA had announced in terms of the batch. We have 2 batches that are affected, which is 2 million doses that are affected, that currently in the store or warehouse in Gqeberha. So that continues. Obviously, we can't ignore the fact that it takes our vaccine rollout a bit backwards. But we have 300,000 that is arriving on Tuesday of the J&J vaccine. And we are currently in discussions. We'll meet with the J&J team next week to try and see how best we can be able to increase the numbers that we are expecting. Pfizer as well, we continue to roll out Pfizer. We're looking for our side as government, we're looking at best possible ways of how we can best get vaccines in terms of the availability, support, but we think currently with how the vaccine registration and the rollout, we are not yet under pressure, but we do anticipate that once we open for the phase 2B, we'll definitely be under pressure and we want to be ready for that.
Thank you, Minister. It's news.
Yeah, it's from Newsroom Africa. Minister, you have recently just stepped into your new role as acting health minister, and you stepped in at a very crucial time where, of course, we are seeing a surge in the COVID-19 numbers, and with Gauteng also being mainly affected. How do you feel that you come into this new role, this acting new role, during this very critical time?
I think for me it's because there's a huge Team South Africa, that is both in cabinet, in provinces, in the department. They are professionals. There's systems in place to be able to respond. My responsibility as a minister is to be able to provide executive leadership, listen to the advisors, and be able to help the country move forward. What we need right now as a country is to hold hands and focus on battling COVID-19. Everything else will come after. Whether how I feel tired or not will come after. For now, I'm expected to perform the responsibility and provide leadership and give hope in terms of this country, and that's what I intend to do.
Thank you, Minister. ENCA?
And Mmamoloko Kubayi-Ngubane, just to get clarity whether the country will be procuring any other vaccines except the ones that we're currently seeing. Are there any plans to actually get more vaccines, including from other countries other than Johnson & Johnson and Pfizer that they currently have?
Yeah, there's quite a lot of the VMAC, for example, currently looking at various issues. Remember the vaccine IMC that is led by the DP also looks at various issues. So they've asked us as the team in health to look at various issues, and hence I said what we are looking for is vaccines that will help the country. So every time what we look at is that what vaccines are available across the globe. their efficacy against South African population and what we have seen in terms of the other variants. We'll do obviously the studies in terms of what we can be able to do in terms of the country. So those processes are currently in place. I know many people have asked us, how far are you with Sputnik? How far are you with Sinovac? Those are some of the things that we're looking at the right time when we have answers finalized with all the clinical trials and the work and available information. We'll provide and announce on those. But it's work in progress. Currently, what we are administering, based on what has been approved by our regulator, it's those vaccines that we are rolling out, Pfizer and J&J.
Thank you, Minister. Go ahead. And please introduce yourself and tell us where you're from.
My name is Amanda. I'm from the Sunday Times. Spoke to the Minister and the Premier. You're sounding very concerned, and this sounds like a red alert. And you are saying that people are not responding positively. Would you be recommending then that maybe tighter restrictions be placed on in Gauteng? I mean, and move us to a much more stricter level in terms of the alert level.
Well, we had a discussion with the team from the National Department of Health. They are going to consider the evidence we have put before them. Everything is decided on the basis of evidence, but we are looking at extraordinary measures. That's all I can say now. What we have at the moment is not adequate, but the detail of that is something that the Minister is also looking at the pandemic trajectory nationwide, because that's what she is there for, to look at the country. Yes, we are worried and we look after the province, but she must compare what is happening here with what is happening nationwide and what is it that may apply here, which is also something that needs to be looked at elsewhere. But the detail of that, if I want to sum it up, is that what we have in place is not adequate. I want to sum it up like that. And the Minister is going to be looking at everything. I think you know Gauteng has the largest population. 1 in every 4 South Africans live in Gauteng. So what happens here has a huge impact even on the pandemic elsewhere in the country. So that's why the Minister is starting her visit to provinces here. So if we are able to contain the spread here, we also linked to other provinces. We're an inland province that what happens here has an impact on Northwest, on the Free State, on Limpopo, on Mpumalanga. And we have lots of mobility between people in Gauteng, also people in KZN and the Eastern Cape. So when, in that sense, when we say the situation is really, really of great concern, and that's what I must say, actually is of grave concern in terms of the pandemic here, the Minister understands it. It has a huge impact nationally. The detail of that, it is something that I can't say, but level 2 measures as they are now are not adequately responding to the pandemic as is raging in our province.
Thank you, Premier. Minister, you want to say anything?
Okay. No, I think from our side is that we have had the province. We have to help in terms of responding. And therefore, as Department of Health will make recommendations towards NCCC, looking at what currently is happening. Yes, indeed, Gauteng, there is a challenge in terms of the numbers, and we have to work to help the health system to be able to cope. And therefore, that response will be announced based on what NCCC takes as a recommendation from us.
Thank you, Minister. Go ahead.
Edwin TV Eyewitness News. Minister, on my way to here at Bara, I've spoken to several people who have now raised concern or fear, particularly with what has happened in the US. Can you assure South African public that the kind of vaccine that they're going to be getting is of a higher standard?
In terms of J&J, as I said, the batches that have been contaminated have not been used. That are said to have been contaminated or identified have not been used. And what we are rolling out and what we would receive next week is not within the batches that are said to be contaminated. So there isn't a need for anyone to fear the vaccines in terms of rollout. We want to urge and we want to appeal to those also, because what we are seeing as well in terms of the vaccine, there's a lot of fake news that are circulating, which are contributing to negative messaging against vaccine rollout. And that I want to say to South Africans that you are not doing us a favor as a country, because we need to reach herd immunity. We need to ensure that, yes, the vaccine is not going to prevent you from getting COVID-19. That's the message we must say. It's helping so that you don't end up in a dire situation where we end up with serious consequences if you get the virus. That's why we continue to say, even if you vaccinate, continue to wear your mask, continue to social distance, continue to be able to wash your hands and sanitize. But appeal for people, if you get information, please verify it. Whether what is being circulated that you receive about the vaccine. I've seen things that people say there's a worm that moves on your hand and all those things. Those fake news, those videos that are being done, please be cautious as South Africans. They are created everywhere. Some of them you can't even hear the language that they are talking on it. So we need to be cautious. President has taken a vaccine as the first citizen of this country, and we all have seen him. So there is no way that if something is not safe, we can risk the first citizen of this country and give it to him. So that's the first message I want to say about vaccine. And we are appealing also as media houses, please help us to make sure that the message that goes into the population, into our citizens, is the message that can encourage vaccination and help our vaccine roll out. Thank you.
Thanks, President.
Good day, Minister. My name is Carol Namakombe. I'm actually a social entrepreneur here in Soweto. I actually run this, the first community wellness newspaper that I launched in 2019. This newspaper is all about creating awareness. I think that in the midst of this pandemic, I think that a lot of awareness needs to still go out there to the people, because what we do with this newspaper, we're able to get it into their houses, we're able to distribute it in clinics, we're able to distribute it in practical general practitioners, we're able to take it to filling stations. And I think that it has a role to play, especially in this pandemic and dealing with things like fake news, demystifying those myths and making sure that people understand all the phases of the vaccine rollout, how they're going to go, who's going to get the vaccine first, all of those things. I think that if we can, I just want to offer myself as a newspaper to say, please help us with all the resources that you can to be able to partner with the department so that we can be able to take this newspaper to all these townships. I would really appreciate to maybe engage further with the office.
I think the province as well will assist with that, yeah.
Well, thank you very much. I think we're going to try and wrap now. I don't know if there's any last burning question. It looks like everybody's fine now. Well, thank you very much, then, colleagues. Let's wrap it and have a good weekend further. Thank you so much.
Yeah, Blaine, that's Acting Health Minister Mmamoloko Kubayi-Ngubane, of course, wrapping up this particular press conference here at Baragwanath Hospital. But I can tell you that, huge concern specifically from Gauteng Premier David Wakura when he mentioned that it looks like this level 2 of the lockdown is not enough in terms of actually battling the rising infections that we see daily. Earlier we mentioned that Gauteng Province actually contributes to more than half of the national numbers that we actually see, 4,800 to, of course, the 8,000 nationally that we saw in the last 24-hour cycle. But I can tell you that he says that we are looking at extraordinary measures, and of course they've presented evidence to the national health team, and in in a way to try and get assistance in terms of actually fighting this pandemic here in Gauteng, and also saying that many people that are here actually leave the province to go to other provinces, and of course implicating others in as far as COVID-19 infections are concerned. But of course, that's a wrap from us here at the Baragwanath Hospital here in Soweto.
Maageketla Mohlabe, appreciate your reporting, sir. Thank you very much indeed. We'll check back with you a little later on. Look, it all boils down to what we've been told since this pandemic has started. The 3 W's, as I like to remember it as. Wash your hands, wear a mask, watch your distance. But the caveat is that all these things in and itself is not complete prophylaxis. So you have to do it as a collective in order to get to this better place as we wait for the vaccines to be rolled out. Look, the National Institute for Communicable Diseases has released